about 2 minutes left, hasn't it, to go through this. So, right, so my challenges. I think I've just shown you my first challenge, which is IT. Being of a certain age, I struggled. So up until this time last year, I'd never heard of Zoom. It was a type of ice lolly that you used to eat. And certainly Microsoft Teams remains a mystery. So that was one of the things. But if I start off with some of my background, so I'm a full-time senior lecturer in pharmacy practice at the University of Huddersfield. Before that, I was a pharmacist and I worked in Boots. So come into academia quite late into my career. And my research is looking at teaching of calculations and pharmacy students. So the calculations that students do during their practice sessions are the types that they would be expected to do when they're out in practice. So based with patients. And despite all our students having a pass in maths at GCSE level, some students still really struggle. Two issues here. The first and the main one is issues for patient safety. Often the pharmacist is the last person that someone would see before they start using their medication. So that final check to make sure that the dosage and everything is correct, then that's really important. But another driver here is assessment. So before you can qualify as a pharmacist in the UK, then you would need to pass an assessment that is set by the regulator. So this is a national assessment. And one of the papers is calculations. So assessment there is driving our teaching. These were my original research questions when I started. So I designed an educational intervention or a set of workshops, and I wanted to find out what these workshops had on the ability of pharmacy students to perform their pharmaceutical calculations. So this is some quantitative analysis looking at exam results. My second one is about perceptions, and this was what pharmacy students felt about calculations before they did the workshops, and then if these had changed after the workshops. The last question, and this is where some of my research has had to change slightly, because we were looking at what effect it had on assessment 6 months after they'd done an original assessment. And that was when COVID struck. So still looking at that one. So say mixed methods. I designed an intervention and used action research and sought the views of students before and after the intervention using focus groups. The part at the end, that's my part where I'm going to look at assessment figures. So progress. A formative test at the beginning of first year studies was completed. I designed the intervention and the workshops were held. We held 4 focus groups before the intervention and 1 after. And luckily, the end of year summative assessment was held in February, and so I managed to get data from that. And then March 2020, the university shut. And the university closed very quickly. And things were quite confused because we were getting things, you know, the university will close in 10 days and then it got down to 3 days. And then it was sort of like, you know, we're not going to come in as from tomorrow. All the remaining assessments in the pharmacy course were moved online. So there was increased levels of anxiety, both for staff, but especially for students. Students were really, really anxious. They'd not completed online assessments before. Everything had been geared up for them coming in and doing online, so all the practice that they'd got. So we had a lot of very anxious students, and it also had an impact on my workload. So having designed all assessments to be done as face-to-face, we at short notice had to put them online. And I also spent a lot of my time just talking to students and trying to keep them up to date, and a lot of reassurance that, you know, whatever happened, we will be with them and we would support them, whilst at the same time trying to get my head around lots of other things as well. So basically, around March time, my research took a back seat. After we'd got through a series of online assessments, then the next part of the workload hit, which was that actually we weren't going to be back into the university in September as we thought, and that most of the following year was going to be online. So that had real impacts on my research. However, talking to my supervisors, I applied for amendment to my ethics and started and did some online synchronous focus groups. So this is where the challenge started. So the challenges, new technology. As you can see, I didn't do it on purpose, and I feel very sorry and quite embarrassed, but my grips of technology, whilst improved hundreds of % better than last year, are still not great. But the other thing as well is that we assume that our students are going to be well versed with the technology, and some of them aren't. And so we can't assume that just because they've grown up and they might assume that they're going to be digital natives, that they aren't, and that caused them problems as well. The other thing was online facilitation. So I'm quite experienced at facilitating focus groups, having done them as part of my master's, but online facilitation was different. Accessibility is a little bit of a two-edged sword. It meant that if people had problems, so some areas where there was particularly poor broadband connectivity, or a lot of our students live, their home life is such that they actually don't have a space for themselves. And so that had issues with people who were willing to come to my focus groups. The use of cameras is a real big problem. So I have got sort of used to talking to circles on Teams. Students are really not happy a lot of the time in using their cameras. And so that meant that the non-verbal communication could be quite difficult. It was difficult on two fronts. The first one is myself picking up sort of like what students weren't saying to me, but also for students, and I think that can have an effect on the interactivity, because when you're sat round a table, you can see when someone's going to speak, whereas when you've got either circles on a screen or you can just see sort of like head and shoulders, it's quite difficult to pick up on some of those. So it will be interesting to have a look at some of the conversations that we had, and to see if there's anything perceivable from changes from online to face-to-face. However, let's think about advantages. So the time and place that we can hold these focus groups suddenly became much, much wider. I didn't have to try and find a room in a university, where booking rooms is not always very easy to have groups. And also a lot of our students commute. So trying to plan anything in after a lecture, you can more or less forget, because they want to go home. So we managed to have a focus group at 5 o'clock one evening, and that just wouldn't have happened if we'd have been doing it face to face. So a lot of times, you know, challenges, but there are some advantages too. So coming to the conference has given me the opportunity to actually reflect on the past 12 months plus. Thinking about facilitation and about how that can go forward, and also about the group's dynamics. I wonder if we have any online fatigue that's showing because students have had an awful lot of time on their own and looking at screens, and whether that will actually impact on the data. But the other positive that outcome is that, believe it or not, then this has sort of like pulled me kicking and screaming into the 21st century. And most of the time, I can actually manage to share a screen. Not always, but I can do that. And it's also had implications for teaching calculations. A lot of the functionality that is available on the VLEs is stuff that I'd never really explored because I didn't have to, and it was really, really out of my comfort zone. And so I was forced into using things, online quizzes. And so the implications for my teaching in the future has really come out of this. And so that is perhaps one of the biggest positives.
ارتاح بس شوي عندي صداع.
Okay, and those are just some of the references that I've used. And thank you very much.
Thank you so much, Elizabeth, and please don't apologize for not being able to share the screen. That's totally okay, especially since the panel